My name's James Cahan. I'm a partner at Thompson, Snell & Passmore in the Clinical Negligence team, and today I'm going to talk about spinal injury cases. So that may be nerve damage, either as a direct result of a spinal operation or as a result of a delay in diagnosing spinal compression or the nerves surrounding the spine, which may be being compressed. For instance, we often are involved in cases involving cauda equina, which is a condition where the nerves at the base of the spine get compressed, causing the loss of bladder function and problems with bowel function. These patients also develop leg weakness and leg pain with associated back pain, and it's an emergency situation. If it's not treated properly and quickly, then the outcome is likely to be permanent, and these patients are often left wheelchair bound and doubly incontinent. We've also been involved in a number of cases involving negligent spinal surgery, which have left patients with either total paralysis or severe leg weakness or severe pain and perhaps an inability to walk and function in normal day-to-day life. If you've had an unexpected outcome after a spinal operation, then you should investigate why that's happened. Sometimes it stems back to the very beginning and why that person has been offered that operation in the first place. And we have found on many occasions that spinal operations have been offered when they shouldn't have been. So we begin by looking at the consent process and whether that operation was necessary or even indicated. If you've suffered nerve damage, then we would look at why that nerve damage has happened and what happened during the operation, and whether that is the type of outcome that can be expected just through bad luck, or whether it's likely to be due to substandard technique or the wrong technique, which does happen. If your case involves cord compression or nerve compression, then we would look at the onset of those symptoms and who was aware in the medical profession, and whether people should have taken more urgent action to rectify the condition and decompress the spine. Well, it depends on the long-term impact that the nerve damage is having on that particular person. So many of our clients will need therapies like hydrotherapy, physiotherapy, often acupuncture for pain or muscle spasms. If you're involved in a case involving cauda equina, then it's going to be stoma support and perhaps support from a specialist urology nurse to help with the bladder dysfunction. We engage the assistance of architects to help convert people's houses or even do full rebuilds where necessary. And we use pain management experts as well as obviously neurosurgeons and spinal surgeons to advise on revision operations if necessary. We often use specialists in aids and equipment, and then we have a panel of people that we go to who can assist us with care and assistance claims as well. So our role in these cases is to guide people through the legal process and to put together a team of experts to build the strongest case that we can. The purpose of the compensation in these cases is to help people rebuild their lives and put them back in the position that they were in before this happened to them. Now, sometimes that means making them financially whole again, but if you're left with long-term physical problems, money isn't necessarily going to do that for you. And where we can, we will try and include in the cases additional claims to help people get back to things they used to enjoy. So for instance, I acted for one client who used to love mountain walking and walking her dog on the beach. So we included in that claim a specialist off-road vehicle to allow her access to the beach and to the woods and wherever she used to go before, to try and help rebuild her life as best we could. On another case, the client was involved in basketball before his injury, and part of the case involved claiming specialist wheelchair basketball equipment and access to appropriate facilities for him to continue that hobby. So it's important that people get the opportunity to put their lives back together, and where we can, we will try and facilitate that for them. If you've been affected by a spinal injury of some kind, or if you want to discuss something that's happened to you in hospital, then please get in contact with us using our website.